Welcome to the Compliance Leadership Lounge podcast, where we dive deep into the world of healthcare compliance, integrity, and leadership. In today's episode, our guest is a former health plan executive and a seasoned board member. With a wealth of experience navigating the intricate landscape of healthcare compliance, she brings invaluable insights into fostering a culture of integrity and ethical leadership. Let's get into those thought-provoking questions. Welcome to the Compliance Leadership Lounge. I'm Ross Ronan, your guide for insightful discussions in healthcare compliance. In our lounge, leaders and experts gather together to share their perspectives and wisdom. So grab a chair, make yourself comfortable, and join the conversation as we dive into the strategies and stories behind effective compliance leadership. Whether you're a CEO, board member, or a compliance enthusiast, you're in the right place to learn, grow, and lead with integrity. Good afternoon, everybody. Today we have Jean Rush, who's a former health plan executive and currently serves on multiple boards of directors and also chairs the compliance committee of some of those boards. Welcome, Jean, to the Compliance Leadership Lounge.
Thank you, Ross. Glad to be here.
Jean and I have known each other for a few years now, and one of my clients came to us and wanted us to build their compliance program and send in as their compliance officer. Jean was the chairman of the compliance committee of that board, had a lot of influence there and having conversations. And I think we did an interview with you right off the bat just to make sure that we were a good fit for what you wanted for that program. It's been a great experience. From my standpoint, getting to know you, I think you have been one of the strongest compliance committee of the board leaders that I've seen in a long time. You ask very poignant questions and you don't leave any stone unturned. So I really have enjoyed our relationship in the past.
That's great.
Tell us a little bit about your experience in healthcare. Where'd you get started and where you're at now?
Sure. So I have had a lengthy career in healthcare, beginning on the payer side of the industry. So for 30 years, I worked for Cigna, the culmination of which was serving as the president of their Medicare division for 10 years. And then I moved on to Centene, where I picked up some Medicaid and ACA experience through running 6 of their health plans nationwide. And then finally, I had the opportunity to bring that all together when I moved over to Highmark Blue Cross Blue Shield. There I was the head of their government markets program and ran their Medicare, Medicaid, and Obamacare businesses across their footprint. Then in 2018, I decided to retire from corporate life, but not retire completely. I decided to move on to my next chapter, which for me was board service, as you alluded to a few minutes ago. And right now, I am very fortunate to serve on the board of directors for 7 health care companies.
Wow.
Because of my payer experience, the board opportunities came mostly on the provider side of the house. And so I'm getting that full spectrum view of the healthcare industry.
So first and foremost, you're a machine to go on 7 boards. That's insane. I sit on one board and I report to a lot of them. And to think that I would have to go through 7 board meetings a quarter is pretty insane. You are a machine. And I know you like to travel and you like to do a lot of fun things. So wrapping all that together with 7 boards is incredible. And then having the payer experience, and I know that at least when we met, you're on the board of a provider side of it. So that's very interesting to get the perspective of the payer side, especially from a compliance perspective. What are the payers looking for? What are they looking at, especially when you talk about Medicaid or different Medicare Advantage plans that some of these payers are participating in? It has a lot of regulations and strict guidelines that you have to meet. And being in the industry, right, you clearly know what they're looking for. So that's amazing that you got that experience. One thing that Compliance Leadership Lounge is about leadership and about relationships. So I always start off with, give me your best book about leadership that you count on, you tell people to go read. I'm sure there's 100 of them that you've done, but what's the number one that's resonated with you over the years?
I have to say it probably isn't a book so much as a program for me. And that program is the National Baldrige Program for Performance Excellence. It's a program that actually was put into place by the U.S. government, the Department of the Interior. And the intent is really to create an integrated framework that will allow corporations, organizations to continuously improve their performance. It isn't prescriptive. It doesn't give you the answers, but rather what it does is to provide an array of assessment tools that allows the leadership team to really take stock of their organization, to identify their strengths, but at the same time to identify opportunities for improvement because the focus is on that continuous improvement. And
Mhm.
it spans the entire range of an organization from strategy and leadership, understanding your customer, operational efficiencies, employee engagement, community involvement, and bottom line financial results. And what's been so interesting about this program is that it applies to all industries, not just healthcare, and it applies to all companies from your mom and pop shops all the way up to your big corporations. So using that program, which I have personally incorporated for the past 20 years, has allowed me to see some really positive and tangible results. And so, definitely something I am interested in sharing with others.
That's incredible. I love the programs that really foster a sense of how to lead, how to be strategic, how to be an executive. And most of the time, we as executives are coming up the ladder don't really feel like we need those kind of things because you have this humbling at some point in time you have this humbling piece where you're like, I need to get to this next level. What are the programs, what are the books, what are the systems in place to help me get there? So that's a great recommendation. I'm going to go look it up now because I haven't heard of that one. That's
You too
I
could use
probably should
it.
have. When we talked about your executive side of the house in healthcare, is there a moment in your journey, in your career, that really said, at this point in time, I am a leader, I'm an executive, and I need to act this way or I need to do these things to be an executive at the highest level within healthcare or in any organization, doesn't really matter. But what was that pivotal moment where all of a sudden just went, oh, here's my light bulb?
I would say that obviously across the course of a long career, there have been many pivotal moments. But I think one of the most enlightening moments occurred to me when I was fairly early in my executive days. I was serving as a vice president of operations. And when I met with my boss, my manager, for a performance appraisal, what he said to me was, what you need to be doing is spending a lot more time outside this company. And at first, that was pretty shocking and a little bit incomprehensible to me. I was spending a lot of time just running my own organization. It was about 2,200 people, dealing with my colleagues throughout the organization, the larger organization, and finding time and value in meeting with people outside of the company was a little bit of a mystery to me. But over time, I began to understand what he was getting at, and that was the importance of building out a network. And in our case, a network within the healthcare industry, going beyond just our corporate view of things to what's important in healthcare, other payers, providers, consultants, specialty groups, etc., so that I really understood the totality of that ecosystem. And so over time, I began working with people from other companies, started talking more with vendors and consultants, joined various organizations like Women Business Leaders in the US healthcare industry or the International Healthcare Academy, and really began to build out those relationships that provided benefits throughout my career. Probably the biggest example of a tangible benefit that I got out of this feedback was when I was making the transition from the corporate world into the world of board service. I reached out to my network to help make some contacts there. And in hindsight, I can say that 100% of the board positions I'm in today actually came out of some sort of networking relationship. So the feedback that he gave me many years ago was very relevant, and it definitely applies today as well as to then.
Isn't that amazing? Because when you're an executive in an organization, especially an organization that's big, where there's 2,200 or 60,000, you really feel like that's your network, right? You feel like those are the people that you need to spend all of your time with and your focus on. And it's amazing how much once you start getting out of that closed, confined network, you don't know who those people know, right? So at some point, somebody's brother, sister, mother, son, whatever, knows somebody who knows somebody that actually is relevant to what it is, what's in your industry. And it really can become this network of people that is just so elaborate over the years that it's pretty amazing. And that's great to hear. That's how you've utilized your experience in getting outside of your comfort zone, and it's actually parlayed very well for you from a board standpoint. So that's
Mhm.
excellent. That's amazing. And we are talking about compliance here. Compliance is healthcare is a very highly regulated. I think it's probably the third or fourth most regulated industry in the United States, with finance and I think airlines being above that. And so as we're dealing with all of these regulations and these healthcare issues in compliance, how do you believe that, what are the most pressing challenges for those healthcare executives, and not necessarily just compliance officers? We call them compliance executives, right? Because we're trying to make them here versus just that compliance officer realm. But like CEOs, CFOs, COOs, what do you think are the most pressing challenges for those individuals to create that or navigate the compliance issues?
That's a really good question. And I would say what I have seen, especially in my board roles, because when I was in corporate America, they were large companies. We had very robust compliance programs. We were well staffed. And when you move into the smaller companies, which are the ones that I'm dealing with now, you find that it's a little bit different world. Many of these companies that I'm working with have just come out of the founder stage. They've had their first investment of real capital from private equity. They're trying to balance their growth objectives, which are, of course, very important, with things like operational maturity and compliance. And so I think from my perspective, the biggest challenge is just creating that awareness among the entire executive team, the
Mhm.
CEO, COO, and all the head of finance, etc. Everybody needs to understand the role that compliance plays, why it's so important, and then the role that they as leaders need to play. It goes beyond the chief compliance officer. Each member of the management team or leadership team really needs to play a very vital role in making compliance real for the organization. One of the things that I've done to help facilitate that is to help them understand how compliance is going to help them achieve their business objectives. It's not separate. It's not competing. It actually is an enabler. And if you fast forward, especially in a private equity type of situation, 4 to 6 years down the road, we're going to be looking at an exit, and we want it to be a successful exit. One of the components of a successful exit is getting a buyer to accept the company, which includes an audit of their billing, an audit of their compliance processes. And so by helping the executives to understand that this is a means to their end, the end that they have in mind, which is creating value, growing the company, improving profitability. Compliance is not a deterrent. It's actually an enabler to help them do that in the right way.
It's a must have, right? And we do due diligence on the other side of it, the sell and buy sell side of it. And I often tell those individuals that we do the sell side due diligence on, I'm like, I know what they're looking for. And
Yes.
this is what you need to have in place. So just fostering that level of compliance and integrity from top down. I assume, as chairman of the compliance committee, which in a lot of organizations, boards don't necessarily go into these compliance committees. They may just have a section of their board of directors that would be able to do it. This episode of the Compliance Leadership Lounge is brought to you by Ronan Healthcare Consultants. At Ronan Healthcare Consultants, we believe in transforming healthcare compliance from a checkbox attitude to a strategic advantage. With decades of expertise, our team of consultants provides innovative solutions tailored to your organization's unique needs. We don't just help you meet your standards, we elevate your business, ensuring ethical practices are at the heart of what you do. Whether you're navigating complex regulations or seeking to enhance your compliance strategy, Ronan Healthcare Consultants is your partner in achieving excellence in healthcare compliance. Ronan Healthcare Consultants, redefining compliance, empowering leadership. Visit us at www.ronanhc.com to learn more. Now back to the show. We've been fortunate enough to work together on a board that has actually put a compliance committee together. And assuming, since you're the chair of that committee, really emphasizing this culture of compliance and integrity fosters down through that role as the chairman. Do you find that you have a little bit more persuasiveness as having that role on the board to foster that culture of integrity and compliance?
Oh, definitely. And to your point, Ross, I think Getting the board to accept a compliance committee is the first step because they don't often think about that. They think about their audit committee, maybe nomination and governance committee, but compliance is sometimes an afterthought, especially in the healthcare space where we are so clearly regulated. It really does make sense to put the emphasis on compliance from the very beginning of the process. And so what I have done with a couple of my organizations is to help them create that compliance subcommittee of the board, to make sure that there's an understanding at the board level of what those 8 elements of an effective compliance program are. It's not intuitive, and if you haven't been heavily immersed in this, you may not realize all the things that need to be done, the policies and procedures, the audits, the training, etc., that are part and parcel of having an effective program in place. And so working with the board to understand that, and then diving deeper with a subset of the board, those board members who have an interest in compliance and want to go deeper on a quarterly basis, forming that committee and then working through that process with them. And in addition to the executive, subcommittee of the board, the compliance subcommittee,
Mhm.
in addition to that, it's also really important to have an executive compliance committee. And I've encouraged that at my companies as well, that we really need to form another separate committee made up of the executives, the heads of each of the departments, because they're the ones who are going to make compliance real in the organization. They're the ones, to your point, that are going to weave it into the culture of the company, that are going to take those elements and make them concrete and real and applicable to everything that every employee in the company does. So I think both components are equally important.
Yeah, and I love the executive compliance committee too. Part of that, as we talk to our CEOs and COOs, is we need you to be a part of this thing, right? And you have to have a dog in this hunt because we're all part of this together. If you just put this on the compliance executive or the compliance officer to say, hey, go take care of all of my problems, it never works out that way. That's never the best way to do it. So
Mm-hmm.
I love that you brought that up. Now, you talked about private equity, which I think is really important. And obviously, the OIG is looking the new guidance that came out not too long ago, I think it's November, and really focusing on following the money and following private equity. There's a lot of different scrutiny, and we just came back from conference, so they even said it out loud at the conference too, which was very interesting. When we talk, and we have a lot of private equity on this podcast as well, and when we look at it, there's got to be this balance of obviously income, obviously revenue, obviously value to healthcare and to making money. But there's also this quality of patient care issue that needs to go. And we all do this. Nobody's in healthcare. I don't care if you're on the payer side. I don't care if you're on the provider side. Doesn't really matter. We're all in this for one reason only, is to provide good quality patient care at the end of the day. And if we all did value-based medicine, that'd be fine too, because we know that the outcomes are where they need to be, but we're never going anywhere for fee-for-service for a while. So when you think about that, how do you think that an organization can balance this kind of regulatory concept of where they need to be, plus growing and being strategic with that quality patient care, at least from your seat?
From my perspective, I think compliance and quality of care actually go hand in hand. I don't see them as being mutually exclusive or oppositional. If you think about the work that we do in either of those categories, it's all about making sure that the patient is getting the right care at the right setting at the right time. That's what we're trying to do. Both compliance and quality of patient care approach that from slightly different angles, but the goal is the same. And so if I think about it from a compliance standpoint, especially in the provider world, we want to make sure that we're billing accurately. When we're
Sure.
billing our commercial payers, but most importantly, when we're billing our government payers like Medicare and Medicaid, we want to make sure that billing is accurate and it represents the work that we're doing with that patient. We put a lot of focus not just on coding, but on documentation. We want to make sure that the medical records are complete, that we have a good understanding of the diagnoses for that patient, that we have understanding of the plan of care for that patient, what we're doing at each individual encounter. And that supports the compliance side, the regulatory compliance of billing. but it also supports patient care because all of those things are really important to make sure that we're taking good care of that patient and documenting it so that the next person who sees that patient has a good understanding of where their care is at. I do think that the work we do in educating our employees about compliance spills over and actually helps to enhance the quality of patient care delivery.
Yeah, and I often tell my clients, and even when I was, back as chief compliance officer, if the quality of patient care and the quality of the documentation works out, the compliance stuff just falls out correct, right?
Mhm.
So
That's
that's where
right.
you start, and then it makes our job as compliance executives and compliance board chairmen
Mhm.
are a lot easier because we can just turn around and say, we know we're doing it right up front. We know patients are taken care of. And I tell this story a lot that used to be in front of the OIG, DOJ, FBI, and big rooms and things like that in my previous life. And if I could pull out a chart and they question the billing or coding of it, if I could pull out a chart and I can go, this is the care that was provided,
Mhm.
this is your mother, this is your grandmother, this is your whatever, this is good quality patient care, whether or not it could have been a little bit better, but this is the care that's provided. 9 times out of 10 they go, I can't argue with good patient quality care. And so then they just drop the whole issue.
That's
So
right.
starting with that, I think, is magnificent. Now, compliance executives, that's what we're trying to build here through our mentorship program and through this podcast, of hearing what it takes to be that next level person. And you, as a compliance chair, compliance committee chair, you're really looking for those individuals who can speak to you, can talk to you, can bring you the right relevant information in a concise manner so that they don't send you off running down a road where you start getting, because as a board member, we know we can get spun up on certain things because everything's it can be an issue at some point in time. Depends on who's talking to whom. But any of these compliance leaders, any advice, anybody who's aspiring to be at that next level, to really sit in front of you on 7 boards and having a legitimate compliance executive discussion, what advice would you give them? What would you say to them to how they should grow to be able to get a seat in front of you?
That also is a very good question that I'm sure a lot of chief compliance officers would be interested in. I think when a chief compliance officer comes into an organization, we're assuming that they've got the foundations of compliance. That's why we hired them. But it's really the softer skills that I think really
Right?
make for an exceptional chief compliance officer. And so, what I would recommend to somebody coming into a new role as the chief compliance officer is, first of all, get to know the business, understand what's important to that company, how they make money, what are their products and their services, how do they create value, how do they serve their customers, what's important to the leadership of the company. Those are all important things to understand so that you in turn can support the organization. The second thing I would say is to build a collaborative relationship with all of your peers, with all of the other leaders throughout the organization, with the management teams under them, with the employees of the organization. Because at the end of the day, while the compliance officer is a quarterback of compliance, it actually takes place out on the floor. It takes place with that patient care, with the management meetings and decisions that are made. So, being able to develop a collaborative relationship gets you a real seat at the table where people view you as a trusted advisor and they come to you and ask for advice up front before they've developed a new product or service or before they've gone down a path of implementing something new. Building up that relationship is really important. Compliance officer obviously has to have some backbone because there are times that they have to stand firm on a concept that may not be popular. But I do think coupling that with a collaborative approach and good communication skills will definitely lead to success in the organization.
You essentially hit on all the pillars we talk about. I love it coming from the person who is hiring these people, and they're sitting in front of you and really hearing what they have to say. Love that. I hope everybody listening takes that and puts it in their notes. And if you're a board member and you're not part of the compliance committee, this is what you should be listening to. This is the information that really protects the organization. So thank you. I appreciate that. Last thing, we talk about being a business athlete, and I ask all my guests this: health is wealth, in my opinion. What do you do to take care of yourself at the end of the day? I know you like to travel. I know you're a very active person. What do you do to just take care of yourself mentally, physically, spiritually, whatever it may be?
I think at the risk of maybe sounding like a page out of the Blue Zones manual, I would say that self-care for me starts with getting a good night's rest, something that I can definitely do now in this role more so than in my corporate days, but making sure that I get a good level of rest coupled with a very balanced diet. For me, tends to be more of a Mediterranean style diet. Lots of exercise, whether that's biking or Zumba or golf or yoga, just making sure that there's a variety of exercise that I participate in on a regular basis. And then really importantly is surrounding myself with people I like and spending time with family and friends, socializing. I think those things combined definitely lead to a healthy lifestyle.
Coming from somebody who sits on 7 boards and does all those things, finding time to work out and eat right and do everything that needs to be done to have that mind, body, and spirit senses is it's great to hear it from you, because there are no excuses, right? You should be able to get out there and do anything that you want to. Gene, thank you so much for spending time with us today. I do want to extend my heartfelt gratitude to you for coming on this show. The invaluable insights that you've given us and given the listeners has been exceptional, and your expertise is beyond compare. Really appreciate it, and thank you so much for joining us today.
Thank you, Ross. Enjoyed it.
Thank you for spending your time with us in the Compliance Leadership Lounge. I'm Ross Ronan, and it's been an honor to host today's insightful discussion. If you've enjoyed our conversation, please subscribe, leave a review, and share this podcast with your network. Your engagement helps us continue to bring in-depth and influential content in the world of healthcare compliance. Stay tuned for our next episode, where we further explore the leadership dynamics in compliance. Until then, remember, effective compliance is about leading with integrity, and leadership is about making a difference.